When it comes to the topic of average penis size, most people are surprised to learn how much misinformation is out there. In reality, the definition of a normal penis size depends on how and where measurements are taken and which studies you're looking at. Globally, research suggests the average penis size is about 13 centimeters, 5 inches, when erect, but there is plenty of variation. These numbers might look small or large depending on what you've seen in media or heard in conversation. Measuring average penis size isn't as simple as it sounds. Different studies use different methods. Some measure length from the pubic bone, others measure only the visible part, and some include girth. The results can vary based on whether measurements are self-reported or done by professionals. Understanding this helps explain why so many men feel uncertain about what's normal. The perception gap is real. Most men overestimate what counts as a normal penis size because of unrealistic standards set by pornography and social media. This gap between reality and perception often leads to unnecessary anxiety and self-doubt. In truth, the range of normal is broader than most people think, and the vast majority of men fall within it. Global statistics highlight how cultural and regional differences can shape our understanding of what's average. For example, studies in different countries report small variations in average penis size, but these differences are rarely significant from a medical perspective. It's important to remember that human bodies come in all shapes and sizes, and this includes genitalia. What really matters is how comfortable someone feels with their own body. Focusing on average penis size can be a distraction from the more important aspects of health and relationships. Instead of comparing yourself to statistics, it's healthier to understand what's realistic and accept the wide range of what's considered normal. So, before moving on, if you're finding this information helpful, make sure to subscribe to the channel right now for more honest, science-based answers to questions you might not hear anywhere else. It's easy to underestimate how much penis size anxiety can affect a person's confidence and happiness. Many men worry about having a small penis, a concern so common that experts call it small penis syndrome. This anxiety often starts early, influenced by unrealistic portrayals in movies, jokes among friends, and even certain medical myths. The constant comparison can quietly eat away at self-esteem. The real truth is that much of this worry isn't based on facts, but on distorted body image perceptions. When someone is fixated on their size, it can impact their relationships, intimacy, and even their performance in other areas of life. Studies show that most partners are less concerned about size than men believe, but these fears can still become overwhelming if left unaddressed. There's also a dangerous cycle at play. The more a man fixates on penis size anxiety, the more he notices evidence that confirms his fears. This is known as confirmation bias, and it can make small insecurities seem much bigger than they are. It's important to recognize when these thoughts start spiraling and to question whether they are really grounded in reality. The myths around small penis syndrome only add fuel to the fire. Popular culture often exaggerates what's considered normal, leaving many men to believe they don't measure up. This creates a gap between what is real and what is imagined, sometimes leading men to seek unnecessary or even risky solutions. Taking a step back and examining the facts is crucial for mental well-being. Not everyone needs therapy, but for some, these feelings of inadequacy can become severe. When penis size anxiety starts to interfere with daily life or causes significant distress, it might be time to seek help from a professional. Therapy can offer strategies to reframe negative thoughts, build confidence, and focus on what truly matters in relationships and self-worth. Addressing body image concerns is not about dismissing feelings, it's about understanding where they come from and learning how to manage them. The journey to self-acceptance can be challenging, but it's an important step toward a healthier mindset and a more fulfilling life. When it comes to penis enlargement scams, there's no shortage of empty promises on the internet. From flashy ads for fake penis pills to suspicious-looking oils and gadgets, the market is flooded with products that claim to increase size overnight. Many men, driven by insecurity or curiosity, fall for these scams, hoping for a quick fix. Unfortunately, these solutions rarely deliver results and often come with hidden risks. Pills and supplements are some of the most common penis enlargement scams. Companies often promise miraculous results with little or no scientific backing. The truth is, there's no pill that can permanently or safely increase penis size. Most of these products rely on placebo effects or short-time changes, if anything at all, leaving consumers disappointed and sometimes exposed to harmful substances. Then there are topical oils and creams, often marketed with bold claims and fake testimonials. These products can cause allergic reactions, skin irritation, and even infections. What's worse, the lack of regulation means you can never be sure what you're actually putting on your body. It's always wise to be skeptical of anything that sounds too good to be true. Why are so many penis enlargement scams out there? The answer is simple: insecurity sells. Companies prey on men's fears, using persuasive marketing and doctored before and after photos. This creates a cycle where men spend money chasing results that never come, further fueling their anxiety and dissatisfaction. It's important to recognize the dangers of unregulated products. Many supplements contain untested ingredients that can interfere with other medications or cause serious health problems. Some men have ended up in emergency rooms after reacting badly to substances they thought were safe. Trustworthy sources, like licensed doctors, will always warn against these shortcuts. At the end of the day, there are no shortcuts or miracle solutions. The best approach is always evidence-based, with safety and long-term health as priorities. If you're tempted by a new product or solution, take a step back, do your research, and talk to a qualified medical professional before trying anything new. The world of manual enlargement is full of promises, but not all of them stand up to scrutiny. One of the most talked about methods is jelqing, a series of exercises meant to stretch and lengthen the penis over time. Videos and guides online make it sound simple and effective, but the real question is, does jelqing really work, and is it safe? Most urologists agree that there's little scientific evidence to support these claims. People searching for quick wins are often drawn to penis exercises, hoping for dramatic results with just a few minutes a day. However, medical research on these techniques is limited and, where studies do exist, the results are far from convincing. The supposed gains are usually temporary or based on anecdotal reports, not solid science. It's important to remember that the penis is made of sensitive tissue, and aggressive manual enlargement exercises can cause harm. Common risks include bruising, pain, loss of sensation, and even permanent damage if the techniques are done incorrectly or too forcefully. The lack of regulation and reliable instruction only increases the chances of something going wrong. Right, hey, let's take a quick break. If you're finding value in this honest, evidence-based information, consider joining our channel's membership club and hit that super like to help keep the channel running strong. Your support makes all the difference. Returning to the topic, while many online forums are full of success stories, these are rarely backed by objective proof. It's easy to find testimonials from people claiming big improvements, but peer-reviewed studies simply don't support the effectiveness or safety of these penis exercises over the long term. Ultimately, the risks often outweigh the potential rewards. Instead of chasing unproven techniques, focus on your overall health and well-being. If you're ever in doubt about what's safe, the best advice is always to consult a medical professional who specializes in men's health. When it comes to penis pumps, curiosity is common. Many men wonder if these devices can offer a real solution for penis enlargement. The science behind the pump, also known as a vacuum device, is simple. It creates a vacuum around the penis, drawing blood into the tissue and causing it to swell. This can make the penis appear larger temporarily, but is it really a long-term fix? Penis pumps have a legitimate medical use. They are often prescribed for men experiencing erectile dysfunction. In this context, vacuum devices can be a helpful, non-invasive tool for achieving and maintaining an erection. Doctors typically recommend them for specific health situations, not as a routine way to increase size. The effects of temporary penis enlargement fade quickly. After the vacuum is released, the penis returns to its normal size within minutes or hours. Some men might see slight improvements in girth or sensitivity, but these changes are short-lived and not permanent. Using the pump too often or incorrectly can even cause harm, including bruising or damage to blood vessels. Some advertisements for penis pumps claim permanent results, but these are misleading. Medical research has not shown any lasting increases in length or girth from regular use. In fact, overusing these devices can lead to long-term problems such as numbness or scarring. The key is to use penis pumps only under professional guidance and to have realistic expectations about what they can do. If you're considering a vacuum device for any reason other than prescribed medical use, talk to your doctor first. Understanding the limitations of penis pumps is crucial for making informed decisions. While they may offer a temporary boost, they are not a miracle solution for anyone seeking lasting changes. Knowledge and caution are your best allies on this journey. When the topic of penis extender devices comes up, many men wonder if they really offer results. A traction device works by gently stretching the penis over extended periods, aiming to trigger tissue growth through consistent tension. This idea sounds promising, but what does the science actually say about it? Unlike many unproven methods, traction has been studied in medical settings. Several clinical trials suggest that certain penis extenders can lead to modest increases in length when used correctly and consistently for several hours each day over the course of several months. However, it's important to remember that these gains are usually small, typically 1 to 2 centimeters, and results can vary. The technology behind a traction device is not new. Orthopedic medicine has used similar principles for decades to encourage tissue growth. However, when it comes to penile tissue, patience and commitment are essential. Most users have to wear the device for at least 4 to 6 hours daily, sometimes for 6 months or more, to see noticeable results. Expected gains from penis extenders are rarely dramatic, but for some men, even a small increase in length can make a psychological difference. It's essential to balance these expectations with an understanding of potential side effects, which include discomfort, bruising, and sometimes temporary numbness. Proper instruction and following the manufacturer's guidelines can help minimize risks. Scientific studies support that traction devices can be scientifically proven to increase length to a limited degree, but there are no guarantees. The market is filled with products of varying quality, and not all devices are created equal. Consulting a urologist before starting any traction regimen is always the safest bet. In summary, while traction devices offer some real science-backed hope for men seeking a modest, non-surgical change, patience and caution remain key. Knowing the facts can help you make smarter decisions for your health and well-being. For some men, the idea of penis enlargement surgery is appealing when other methods fall short. Surgical options such as penile lengthening, ligament release, implants, and injectable fillers promise more dramatic results than non-surgical techniques. But as with any surgery, there are significant surgery risks that should be carefully weighed before making a decision. One of the most common procedures is ligament release, where the suspensory ligament of the penis is cut to allow more of it to hang outside the body. While this may increase perceived length, it does not make the penis longer when erect and can sometimes affect stability or angle during intercourse. There's also a risk that scar tissue may form, which could even shorten the penis over time. Implants and fillers offer other options for those seeking additional length or girth. These methods are more invasive and come with higher costs and possible complications. Risks include infection, rejection of the implant, changes in sensation, or even the need for additional surgeries to correct issues. It's not uncommon for men to be dissatisfied with the results if expectations are unrealistic. Cost is another major consideration. Penile lengthening and enhancement surgeries can be expensive, and most health insurance plans do not cover them when done for cosmetic reasons. It's important to ask questions about recovery time, follow-up care, and the likelihood of needing future procedures. Doctors emphasize that surgery should only be considered when there's a clear medical need or after all non-surgical options have been exhausted. Many men are ultimately happier focusing on realistic goals rather than chasing perfection through surgery. Understanding the surgery risks is crucial before making any decision. An honest discussion with a qualified urologist can help clarify whether surgery is an appropriate option, what the likely outcomes are, and how to avoid disappointment or regret. The search for a quick and noticeable change has made penis filler and fat grafting increasingly popular. These methods involve penile injection of various substances, like hyaluronic acid or the patient's own fat, directly into the penis to increase girth. Some clinics market these treatments as fast, minimally invasive, and effective. But how do they really stack up in terms of safety and long-term results? Types of injectable treatments can vary widely. Some use approved medical fillers, while others rely on techniques that are still experimental. The quality and experience of the practitioner play a huge role in the outcome, but even in the best hands, results can be unpredictable. Irregularities in shape, lumps, or unevenness are common complaints after these procedures. When it comes to fat grafting, doctors remove fat from another part of the patient's body and inject it into the penis. While this method can provide temporary gains in girth, much of the injected fat is usually reabsorbed by the body within months. As a result, repeated treatments may be needed to maintain any increase. Safety is always a concern with any penile injection procedure. Risks include infection, allergic reaction, migration of the filler, and the development of nodules or scar tissue. Some complications can be difficult or even impossible to reverse, so it's crucial to approach these procedures with caution. The long-term outcomes of penis fillers and fat grafting are still being studied. For many, the gains are short-lived, and the potential for complications remains high. Most urologists recommend against these procedures unless there is a strong medical reason, and even then, only with a specialist who has extensive experience in male genital treatments. Ultimately, while injectable options might sound appealing, the risks often outweigh the benefits. If you're considering any form of penile injection, consult a qualified urologist first to fully understand what's involved and whether it's really the best path forward. Many men wonder if there are natural penis growth methods that actually work. The reality is that genetics and hormones, especially during puberty, play the most significant role in determining penis size. Most growth occurs during adolescence, and after puberty, the size remains largely unchanged. There are no foods, supplements, or exercises proven to increase penis size after this stage of development. That said, lifestyle does have an indirect impact. Poor habits like smoking, excessive drinking, or being overweight can affect blood flow, hormone levels, and overall sexual health. While these factors won't change the actual size, they can impact function and the appearance of the penis. Maintaining a healthy lifestyle can improve confidence and performance, which sometimes gets mistaken for physical growth. The role of puberty penis growth is well established in scientific literature. During this period, surges in testosterone lead to most of the physical changes, including penile development. After puberty ends, these changes plateau, and further natural growth is extremely rare. Understanding these limits can help men set realistic expectations and avoid falling for false promises. Some believe that certain exercises or diets can trigger natural penis growth, but there's no credible evidence to support these claims. Instead, focusing on general wellness, like staying active, eating well, and getting enough sleep, supports sexual health in broader ways. Psychological health also plays a role in body image and satisfaction. For those concerned about lifestyle and penis size, it's more beneficial to target factors you can control. Managing stress, staying fit, and having open conversations with partners often do more for satisfaction and confidence than chasing unproven methods. The key is understanding what's scientifically possible and letting go of unrealistic expectations. Ultimately, while you can't change your anatomy through lifestyle alone, you can influence your health and satisfaction. Focusing on what you can improve is empowering and leads to better overall well-being, physically and mentally. Before we dive in, if you found these insights valuable, don't forget to join our members club. Smash that super like to help us keep the channel running, hit subscribe, and share your thoughts in the comments below. Your support keeps honest health information coming. When it comes to urologist advice penis, most medical professionals agree satisfaction and confidence matter more than chasing unrealistic numbers. While concerns about size are common, the vast majority of men fall within the normal range, and partners typically care more about intimacy and trust than measurements. Doctors focus on evidence-based health, not miracle fixes. A key part of what doctors recommend penis size is recognizing when concern turns to obsession. If worries about size are causing real distress or interfering with relationships, it's wise to seek professional guidance. Urologists can offer reassurance, discuss real options, and help manage expectations. Often, counseling or open conversations with a partner do more to improve satisfaction than any product or procedure. For those considering treatments, evidence-based choices are crucial. Procedures like traction devices or, in rare cases, surgery might be discussed, but only when there's a medical indication and after all non-invasive paths have been explored. Quick fixes and unproven solutions are best avoided. They often cause more harm than good. Doctors encourage focusing on overall health and realistic goals. A balanced lifestyle, honest communication, and good self-care go much further toward happiness than chasing the perfect number. Remember, urologist advice penis is about science, not fantasy. Ground your choices in facts, not promises. At the end of the day, confidence comes from self-acceptance and a healthy mindset. If you ever have doubts, reach out to a medical professional who can offer honest, individualized advice. That's the best path to satisfaction, both for your health and your relationships.